skeletal muscle features of Turner syndrome. We said that the most common feature is short stature. But what are the features on skeletal muscle examination? Number one, increased upper to lower segment ratio. So it looks like, their upper body is longer than their lower body. Number two, defective dental development. So they may have malocclusion. Number three, they may have small mouth. Number four, they have cubitus valgus, okay? Number five, they have kyphosis. So there's a problem with their spine. They have a short neck, and they have genu valgum. And they also have a high-arched palate as well. The palate is high-arched. And they have widely spaced nipples and a broad chest. And they may have short metacarpals. Their metacarpals may be short. So don't confuse short metacarpals with long metacarpals. Short metacarpals. And they may have scoliosis as well. And then they may have Maitland deformity. Okay. Now let's go to lymphatic features. Lymphatic features of patients with Turner syndrome. Lymphatic features. They may have a low posterior hairline. They may have edema of the hands and the feet. And they may have, characteristic dermatoglyphics, some stuff on the skin. And they may have a webbed neck. And they may have earlobe abnormalities. Their ears may be abnormal. Because especially for those who are going for the exam next year, because the exam is now going to focus more on MCQs. For example, a lot of MCQs can come out of, features, right? So don't just learn the common ones, learn some of the uncommon ones as well, so that if it's put in a question format for you, you can be able to deal with it. Okay, good. And then they can also have nail dysplasia, dysplastic nails. Now, what are the fertility concerns? This is also very important. Fertility concerns, because it will affect the way you're going to manage the patient. Fertility concerns in patients with Turner syndrome. They may have, germ cell chromosomal defects, and they may present with infertility, ovarian failure, gonadal dysgenesis, and gonadoblastoma. Okay, infertility, ovarian failure, gonadal dysgenesis, and gonadal failure. And then they can also have gonadoblastoma. So if we ask what germ cell tumor is associated with Turner syndrome, it is gonadoblastoma. Please write that down. What germ cell tumor is associated with Turner syndrome? It is gonadoblastoma. Then what other dermatology features can be seen in patients with Turner syndrome? Multiple pigmented navy, number one. Number two, they may have vitiligo. Number three, they may have alopecia, concerns with hair distribution. What about autoimmune conditions? So if you have a patient with Turner syndrome, what are the autoimmune conditions which are associated with them? Number one, they may have thyroiditis. And this is an exam trick. With a thyroiditis, I can ask a simple question on thyroiditis and Turner syndrome, TNT, in relation to age. Does thyroiditis increase in rate or decrease in rate as the patient grows? In a patient with Turner syndrome, the rate of thyroiditis increases with age. It increases with age. And they can also have, the risk of celiac disease and inflammatory bowel disease. And then what are the ENT complications, ENT concerns? These patients can have recurrent otitis media, sensorineural hearing loss, okay, conductive hearing loss, and cholesteatoma. Recurrent otitis media, so recurrent ear infections, hearing loss, sensorineural hearing loss, conductive hearing. So they can even have mixed, because they can have sensorineural and then conductive, and they can also develop cholesteatoma. And then what about their eyes? They can have myopia, and then they can also have strabismus as well. And then they can have amblyopia, and they can have ptosis. So ptosis is like drooping of the eyelid, right? Okay. And then what about kidney complications? Kidney complications. They can have concerns with their collecting system. They can have horseshoe kidneys. They can have hypertension. So collecting system malformations, horseshoe kidneys, and hypertension. These are complications of, or these are renal features in patients with Turner syndrome. And then what about the heart? The heart, the heart. Now, if you don't even remember anything, I want you to remember this first one. Elongated transverse aortic arch. Elongated transverse aortic arch. That is the commonest cardiac feature in patients with Turner syndrome. Elongated transverse aortic arch. That is the commonest cardiac feature in patients with Turner syndrome. So I can drop a whole question. I can develop a whole question with this table alone. What is the most likely cardiac feature you will see in an 18-year-old girl whose height is below the 5th percentile and mother has brought her into the clinic for amenorrhea? And the answer everybody would tell me, including Dr. Gloria Datson, Dr. Damilola, Dr. Georgina Pinting, everybody on the Zoom call right now should tell me is the patient will have elongated transverse aortic arch. There are other cardiac concerns like, aortic valve abnormalities, coarctation of the aorta. And with coarctation of the aorta, part of your physical exam will be that I'm going to measure the blood pressure of the patient on both hands. So in your, if you are, like, for example, in a CDM case, if you have to write your physical exam of a patient and you get to cardiovascular exam, one thing I would like you to really, really do, one thing I want you to really, really do is to say that I will check the blood pressure on both sides. Why? Because of the issue of coarctation of the aorta. And then they can also have pulmonary venous abnormalities, systemic venous abnormalities, such as like a persistent left superior vena cava, ventricular septal defects, atrial septal defects. But the one cardiac condition I want you to always remember is elongated transverse aortic arch, ETAA, elongated transverse aortic arch. Now, remember that I told you that there's one germ cell tumor, which is usually associated with these patients with Turner syndrome. And that germ cell tumor is gonadoblastoma. G for G, gonadoblastoma, G for G. So these are, exam tips that if you are learning for Turner syndrome, you've got to make sure that I've covered gonadoblastoma, I've covered the most common cardiac complication, I've covered the most common physical examination presentation, I've covered when they are likely to be picked up, I've covered the most common karyotype, right? I've covered, some, at least 2 concerns per every organ system.